with Laura Diggle at Ivy Tech Community College. We are here to talk to Laura about medical assisting. What do they do?
What does a medical assistant do? Medical assistant is the individual, when you go to the doctor, who's going to be possibly sitting at the front desk, checking you in, verifying appointments, verifying insurance, those types of things. They could also be the individual who calls your name, brings you back, does your vital signs, performs tests, draws blood, those types of things. They may even be involved in certain minor procedures. And then at the end, on the back end of things, kind of behind the scenes, they're also involved in some insurance and other administrative tasks. So they're very, very well cross-trained, and they can fill most of the roles in the medical office.
Good. Are there jobs after graduation?
Absolutely. One of the great things about medical assisting right now is it's very in demand, especially for individuals who go through programs like the medical assisting program at Ivy Tech, which is accredited and prepares you to sit for the Certified Medical Assistant exam. The last three semesters here at the Anderson campus, I can't speak for the other campuses, but I know for us, we've had a 100% placement rate. The majority of our graduates, when they're in their final semester, have actually secured employment prior to even finishing their classes.
That's wonderful.
So outlook is great.
Good. Great. How much can I make or expect to make after I would graduate from medical assisting?
That's a great question. Right now, the average is anywhere from around $14 an hour all the way up to $17 an hour. It just depends on the type of practice you work in, who your employer is, and even what type of shift you're willing to work. If you're willing to do something that's maybe late nights or over the weekends, you may get a little differential and make a little more.
Okay. Sure. Good. What degrees are available?
Another good
for
question.
medical assisting?
Currently, throughout our state, we offer an Associate of Applied Science degree as well as a technical certificate. It just depends on the specific campus. So if you live near a certain campus and you want to know for sure, go to the Ivy Tech website, ivytech.edu, and select medical assisting. And then from there, select the campus nearest to you. And you can email or call the program chair at that location. They can let you know which programs they offer. They can also set up an appointment if you want more information on the program. And they can also let you know if their specific program is select entry or open enrollment, meaning you would either have to apply and be accepted, or you can simply come in, sign up for classes, and get started immediately.
Great.
Great. Well, thank you, Mandy.
You're welcome.
All right.
That's great, Laura.
Fantastic. Okay, so we're going to go ahead and start with a simulation of a day in the life of a medical assistant, brought to you by the Anderson Medical Assisting students. All righty. And here comes our patient.
Hi, welcome. How are you? Good. How are you? Good. Who are you here to see?
I'm here to see Dr.
Yes, Dr. Sanders is here today. And what's your name?
Mackenzie Campbell.
Yep, there you are. Do you have your copay? I see that you have a $30 copay.
Yes.
And your insurance card?
Yes.
Thank you. Perfect. There we go. Thank you very much. You can actually have a seat in our waiting room.
Okay.
And we'll call you in a little bit.
Thank you.
Thank you.
All right, Mackenzie. Hi, Mackenzie. I'm Caitlin. I'm a student medical assistant for Dr. Swinger. I'm just going to get your vitals, okay? Okay. All right. You got to go ahead and get your weight and height. Can you step up on the scale for me?
When students are in the medical assisting program, they can expect to learn to do a complete set of vitals on patients: height, weight, pulse,
Your back facing, yes.
temperature,
Go ahead and step back up.
pulse oximetry, and blood pressure.
All right, nice and tall. Okay, step off. All right. And go ahead and have a seat right here. Okay, I'm going to get your blood pressure. Is your left arm okay to use? All right. Okay, roll up your sleeve for me. All right. It's just going to feel like a tight squeeze, okay? Okay. 126/96. You feeling okay?
Yeah.
Okay. Alright, I'm also gonna get your temperature, okay? You can go ahead and put your sleeve down. While I'm doing your temperature, I'm gonna grab your oxygen as well, okay? So I'm just gonna need your pointer finger, and I'm gonna get your temperature. Okay, it's gonna go right underneath the tongue, and close your mouth around it for me, please. Alright, 98.8, no temperature. And, alright, thank you. Lastly, I'm just gonna get your pulse. I'm gonna get your wrist. Alright. Okay, Mackenzie, that is everything. So, Dr. Singer will see you here in just a minute, okay? Alright, thank you.
Based on the physician's initial assessment, he has asked the patient to provide a urine sample, which Amanda will now test.
Hi. Hi. Mackenzie. Yes. I'm Dr. Singer's medical assistant. He's ordered a urinalysis for you. I went ahead and got your sample from the other medical assistant. Can I go ahead and verify your name and your date of birth?
Mackenzie Campbell, 8/9/93.
Thank you. And I'm going to go ahead and test that, and you should have your results here in a couple of minutes.
Okay, thank you.
Now, Amanda is going to perform a manual and then an automated check of the patient's urine. This particular test is something that you can expect to learn in one of our lab classes, MEAS 219, which are laboratory techniques. We spend a great deal of time on this chapter, as this is one of the important clinical tasks that the medical assistants perform on a daily basis. Amanda, how long do we have to run this test?
2 minutes.
2 minutes, okay. And what are some of the things that we test for with this particular test?
For this, we test for blood in the urine, we test for bilirubin, ketones, specific gravity, we test for the pH, protein, and urobilirubin, and leukocytes.
Okay, fantastic. Okay, great. Next up, to go ahead and verify our manual results, she's going to go ahead and perform an automated test on the ClinTest machine, just to verify her results. Another medical assistant who will then be performing another test from our laboratory class. She's going to do a finger stick with a small blood sample and test the patient's hemoglobin.
Hi, Mackenzie.
Hi.
How are you today?
Good, how are you?
Good. I am Morgan. I am Dr. Singer's SMA today, and he has ordered you a hemoglobin test.
Okay.
So if you want to go ahead and come over here and sit in this chair for me.
Okay.
Can you verify your date of birth for me before we get started?
8/9/93.
Very nice. Have you ever had one of these done before?
No.
Okay. You have a preference on which hand you want to use?
Maybe this one.
Okay. Alright. Is this finger okay? Sure. Alright.
For this test, we'll take a small sample of blood from the patient's finger. Once Morgan sticks the patient's finger, she will wipe away the first drop of blood, collect the second drop, and perform the hemoglobin test, which gives a fairly immediate result as well. patient seems to have tolerated the procedure well.
You
She
doing
hasn't.
okay?
Good. Some of the main functions of a medical assistant, besides the actual physical skills, are being personable, showing empathy, and always communicating with the patient and doing a lot of patient teaching. It's incredibly important that you be willing to work with people from all walks of life, because you will deal with all of them.
Doing great. Are you feeling alright? Okay, good. Gotta get a nice big drop of blood right in the center of that.
Okay.
Perfect.
Alright.
We're gonna go ahead and apply pressure to your finger, just like that, and this is what it should look like.
Fantastic. Good job, Lauren. Alrighty. So Morgan will go ahead and clean the site,
Let's take a look.
check for bleeding, apply a Band-Aid,
Okay.
and at this point, the patient has had all their tests performed, and they can be dismissed and checked out at the front desk.
Alright, you are all finished, so we're gonna go ahead and head out, and we'll get your next appointment scheduled.
Looks like we need to set up an appointment for 2 weeks from now. It's gonna be the 9th of July. Does 11:30 work for you? Yeah? Let me get that scheduled for you. Alright. Let me just grab it for you, and that way you've got a paper to take home with you, okay? Alright. And you're all set. You'll
Thank you
be
so
on
much.
July 9th at 11:30, okay?
Okay, thank you.
We have just simulated a very possible day in the life of a medical assistant. Mandy's going to return and ask some follow-up questions to get you information if you're interested in the medical assisting field here at Ivy Tech, either in Anderson or the Madison County area, or anywhere in the state.
Hi, Laura.
Hello.
So what do medical assistants do?
Well, I think we just saw a pretty good snapshot of the day. There's the administrative side where we had Sue and Carly checking in our patients, verifying information, collecting copays, and also checking out patients, scheduling follow-ups, and also sometimes submitting insurance information and encounter forms for reimbursement. So, and from there, obviously we have the clinical side, which for me, that's kind of where my passion is. Although this is a necessary part of the job, I think the real thrill for a lot of people is being in the room with the patient, doing the vital signs, doing the skills, especially things like the CLIA wave testing that we saw. CLIA wave testing is a big part of our lab class, and basically kind of the short, sweet definition of that is any kind of testing that requires minimal interpretation. So we're looking at a positive, negative, an actual quantitative result, we get a number, that type of testing, blood draws, and patient teaching. So if you're a people person, you want to be there, the good, the bad, the ugly, and help people, this is definitely the right place, and I think we saw a lot of what we did today.
Are there jobs after graduation?
Absolutely, absolutely. That is a real hot spot for us, especially here in Madison County. The demand is extremely high. Some of our big employers in this area at least, Community Health Network, St. Vincent, Madison County Community Health Department, all those people are consistently, and there's others, but they consistently will email, call me, and say, hey, do you have a graduate? And lately, honestly, it's been, I'm sorry I don't, because they're all hired. And I love it, but I hate it at the same time. So we need more students to fill the void in not only Madison County, but the other counties throughout the state. So yes, you will absolutely have a job when you graduate,
Okay.
as long as you can interview. I can't do that for you.
Oh. How much would I typically make having a career in medical assisting?
Good question. Typically right now it's averaging anywhere from 14 on up to 17. Again, that's going to depend on the type of practice you work in, the hours you want to work, your employer, and of course the type of shift. So it's up to you. Okay.
And what type of degrees are offered after graduation?
Sure.
Or for graduation?
Sure. You can enroll in either the Associate of Applied Science degree, or you can also seek the technical certificate. Both of them prepare you for the CMA exam, which certifies you as a medical assistant. The great thing about being a CMA is that certification is national. So if sometime, life changes, you get married, something, you move, you don't have to recertify in a different state. That travels with you. As long as you maintain your certification, you have to do 60 continuing education units every 5 years. But as long as you complete that, you're going to stay current, and you should be able to take that CMA anywhere you want. But the technical certificate is definitely the shorter route to get there. The Associate of Applied Science just involves more courses. It gets you a little more information, and I think makes you a better trained CMA. But for those people who want to get in, get out, or just fired up and just want to work, the technical certificate is perfectly fine as well. And we are starting a new cohort in both in the fall. Classes start up again in August. So
That's wonderful.
if you're interested in getting more information about the medical assisting program or signing up for classes and getting started, please go to ivytech.edu. You can look for the information on medical assisting, and you can also choose the drop-down for the campus nearest you. Either go to your campus, or you can contact the program chair for your area and get more information. Either call them, email them, whatever you choose. But please reach out, get in early. Classes are filling up fast. All right. I want to say thank you to all the ladies of the Anderson Medical Assisting Program, and I appreciate everyone tuning in. We appreciate your time, and thank you for joining us.